So here we've got a really interesting case, an elderly patient with lymphoma undergoing chemotherapy, and we're being asked to evaluate their response to treatment. Now, you might wonder how we go about figuring that out, right? It's all in the imaging and the clinical signs. So let's break it down. We've got a chest radiograph here, and as always, I'll walk you through it step by step. First thing that jumps out is that the lungs are clear. That's a good sign in a patient like this. There's no obvious infection or consolidation, which could sometimes complicate things. But that's not what we're really focusing on here. Now let's talk about the main finding. What we see is this linear structure extending from the right upper lobe pulmonary artery to the left lower lobe artery. This is important because we're looking for signs of a PICC line. And guess what? There's no PICC line visible in the chest anymore. So, right off the bat, we know something is off. Let's think for a moment. What could cause this? Based on the radiographic findings, the diagnosis that comes to mind is a PICC line embolus. Essentially, the line has migrated from its intended position and is now floating in the pulmonary arteries. And wow, that's definitely something we need to act on. The differential diagnosis here is really limited, to be honest. The only other thing we'd consider is whether we're looking at an artifact, something external like a wire or tube that's lying on the patient's body, but that's unlikely. The pattern of the line suggests it's inside the body, not on the surface. Now, what's the next step? This is where management comes into play. First, and this is key, we need to review the old imaging. I always say, compare, compare, compare. That's Radiology 101. In this case, the previous film had shown a left PICC line in situ, so it looks like we've got clear evidence of migration. Once you've reviewed the previous imaging, it's time for the lateral chest radiograph. This gives us more information, especially since we want to make sure that this isn't some tricky artifact playing tricks on us. Next up, inform the oncologists. This is an urgent situation. You don't want the line to cause any complications, so getting the team on board is critical. And then the real intervention begins. The interventional radiologist will likely snare the line and remove it. That's the treatment for a PICC line embolus, and honestly, it's a great example of radiology not just diagnosing, but actively treating issues like this. Now let's talk a little bit about the mechanics of this. A PICC line is basically a long catheter that gets inserted into the arm, goes into a big vein, and ends up near the heart. It's used for patients like this one who need long-term chemotherapy or antibiotics. Complications with PICC lines can include things like infections, but in this case, we're seeing a rare but serious issue: line embolization. Line embolization happens when the catheter breaks or gets damaged somehow, and a fragment of it migrates to the lungs. The line piece is usually picked up on chest x-rays, and like we saw in this case, we can see the embolized fragment tracking through the pulmonary arteries. This is something you don't want to miss because it can lead to significant morbidity if it's not addressed quickly. In this case, the line was embolized, and the interventional radiologist had to go in and snare the line fragment. Fluoroscopy is often used to visualize the catheter more clearly, and once they've got a hold of it, they can pull it out safely. The good news is that most patients, like this one, recover well after the embolized line is removed. So yeah, this is a great case that highlights the importance of reviewing imaging thoroughly and acting quickly when complications arise, especially in patients who are undergoing treatments like chemotherapy. Radiology not only helps in diagnosis, but also guides management in critical situations like this. All right, that's it for this case. If you found this discussion helpful, don't forget to subscribe to Radiology Made Easy for more insights like this one. Feel free to comment your thoughts or questions below. And hey, if you'd like to support us, check out the link in the description to buy us a coffee. Every bit helps us keep bringing you these educational discussions.